And it's also important to know that there are things that we can do, but it comes down to us recognizing signs and symptoms and changing our lens sometimes because, Jackie, grief and loss gets in the way. We want our kids to do well. Our kids want to do well. And so when there's repeated failures on both ends, from where the parents are interpreting failures, the individual is interpreting failures. So we're not even able to frame it for the families and the individuals on the spectrum that hope is even possible because we're not even believing people for the most part. Because why? Our kids look normal, they talk normal, and yet when they act like this, the royal we say it's attitude, drama queen, that, just get through it, just get with it. And so you're also telling me that frustration that the families feel.
For sure. Well, and I think for families, you guys know it's up and down. It's difficult to communicate. And then you go with systems of support and try to communicate that. And their response is either to judge your kids or judge you. And boy, does that ever make it hard to reach out and ask for help, because it's like, okay, now I'm to blame. And now I don't even want to ask for help, and I desperately need help. But all I do is I feel like I walk in and people look at me like I've done something wrong. And this failure to understand is a problem. It doesn't mean there isn't hope, and we're going to get there. We're going to talk about the opportunities. But I think before we get to that, we actually have to sit in the frustration a little bit.
Sit in the shit. That's what we call it.
Sit in the shit, because it's real. It's real, and it sucks, and you're not alone, and we need to know that. And that's why we do the work we do, because the more we learn, the more we can gather this science stuff that if people are saying, I don't believe you, the caregiver, because heaven forbid we recognize your expertise, but maybe as we get more science and more stuff, and we can say, hey, this brain looks different. This, microbiome is different. Here, people, look at this. They're not making this stuff up.
This stress response system is different.
Stress response.
They see the world different.
Right.